have you been able to gather so far?
From Kericho Green Stadium, which has been renamed to Kiproguto Chumo Stadium here in Kericho County. And today morning, as we were planning to celebrate Mashujaa Day, we had a sad incident at around 3 a.m. when the members of the public were trying to gain entry to the stadium using Gate C, where the Kericho East Police Station has confirmed that there is a woman who poured hot tea in a fire that caused commotion, where people thought they were being thrown a grenade, not a grenade, tear gas, and they tried to run around. And in that commotion, several people got injured, and some even lost their lives. According to Kericho County Referral Hospital, actually, people have been confirmed dead. The 4 people are women who have been confirmed dead today morning when they were taken for treatment at the facility. And also we have around 10 people with severe injuries and around 4 people with soft tissue injuries. Therefore, it's a sad incident that occurred around 3 a.m. in the morning, where members of the public were trying to gain entry to the stadium to attend the Mashujaa Day celebrations. And to our viewers, will be keeping them up to date in subsequent bulletins on how those who are injured are faring on so far. And on Mashujaa Day celebration, President William Ruto today launched or relaunched universal health care coverage across the country. This is the 3rd attempt the country is making at ensuring that everyone has equal access to the highest attainable health care services in the country. President William Ruto said that the previous attempts have failed because they were not anchored in law. But today, the country has laws that will be the fulcrum of universal health coverage, and this will ensure that there is regulations to ensure the success to universal health coverage. So the president yesterday assented 4 laws, namely Social Health Insurance Act, we have Digital Health Insurance Act, we have the Facilities Improvement Financing Act, and the Primary Healthcare Act. And this will ensure that the Primary Healthcare Act will ensure that every Kenyan has free access to medical services, where they can walk into hospital and access care at any time they need. And also today, President William Ruto rolled out community health promoters, 100,000 of them, where each community health promoter will be overseeing 100 households in their community, or where they are staying, or their locality where they're coming from. And therefore, these community health promoters, they have been kitted with several equipments that they'll be using to check how the public's faring on. They'll be able to check on malnutrition status of children, check on measure blood pressure, blood sugar levels, and they'll be transmitting the records back to the national government, where the Digital Health Act now comes in, that the government will be able to have access to up-to-date records and data of Kenyans and how they're faring on health-wise. And therefore, these community health promoters will be paid by the national government 2,500 shillings, and also co-paid by the county government 2,500 shillings. In total, that is 5,000 shillings that they will be paid. And also, will be in the next 12 months, we'll be having a transition from NHIF, which has been repealed. Now comes the new four laws that will be governing on how the health sector will be running and moving forward. So we'll be having the Social Health Insurance Authority, that where Kenyans will be paying premiums to. The percentage of what Kenyans will be paying so far has not been agreed on, and the president said that the regulations will come on board later. But the rich will pay for the poor, and the young will pay for the old, to ensure there's equity when it comes to the payment of the premiums compared to NHIF, where it was capped at 2.75%, and you will find that other people are paying more percentage of their salary compared to others, especially those who are earning more. Therefore, we are hoping that the UHC, which has been rolled out today, will be a success and not a failure like the other attempts that the country had tried to make. And now, Lastly, the president also issued a warning to corrupt individuals because, you know, the health bills, we have the Facilities Financing Act, where hospitals will have to use the money they collect in their facilities to improve their facilities, and this creates room for corruption. Therefore, the president issued a stern warning to public servants and those and medics also who are in charge of hospitals that there will be no room for corruption in the country. Back to you, Jimmy.
All right, Beldin, thank you very much. Now, let's have a look at some of the things that the president said. Now, Kenyans will now require to obtain a social insurance card under the revamped Universal Health Coverage Plan. The contribution towards the scheme will be pegged on income, with unemployed Kenyans getting treatment at no cost. Now, the president explained how the plan will work, even as he announced the community health workers would be paid for their services.
As many Kenyans as possible the opportunity to be their best so that they can move our country, our nation forward into a destiny that we all share as a people. The Constitution guarantees Kenyans the right to the highest standards of health. Since independence, successive governments have made efforts in guaranteeing access to quality and affordable health care for Kenyans, but with limited success. There have been several attempts and efforts to achieve universal health coverage, one in 2003, in 2013, and in 2018. However, these efforts were met with little success. It is for this reason that the government of Kenya identified healthcare delivery as one of the core pillars of the bottom-up economic transformation agenda. In the Kenya Kwanza Manifesto, we made several commitments towards the delivery of universal health coverage. These include the provision of a fully public financed primary health care, the installation of a digital health management information system, and the setting up of a fund for improving healthcare facilities across Kenya. Other commitments were the setting up of an emergency medical treatment fund, the establishment of a national insurance fund that covers all Kenyans, and the availability of medical staff who would deliver on this great universal health coverage that has been in the works for a long time. The government has instituted a paradigm shift to preventive and promotive health rather than where we've been at curative health. This approach also makes economic sense. Community health reports state that for every 1 shilling invested in community health, 9 shillings and 40 cents are realized in economic and social gains in our society. In our plan, delivery of primary health services at community level will start with community health promoters. And we are very proud that they are represented in large numbers today in this very important Mashujaa.